Welcome back. I'm Dr. Jeff Hawkins and you're watching Phenomenal Health. Today I've got a doctor of chiropractic on as my guest, Dr. Maxwell Synsvoll. He's been practicing in the Vancouver area for the past 4 years. Dr. Synsvoll is a graduate of Northwestern College of Chiropractic, which is one of the best chiropractic colleges in the country, and is a board-certified doctor of chiropractic. Today I'm going to be asking him some tough questions about what he does to treat pain. Don't worry, I'll be asking him the questions that you would want asked, and I won't let him off the hook until all my questions are answered. Now, our research has uncovered that chiropractic is now the most popular non-drug and non-surgical treatment for pain in the United States, with thousands of professional athletes and celebrities going every year. Now, let's get right to the interview so I can find out for you why chiropractic has become so popular. Okay, doctor, now as I was preparing for this show, I did some research, as I mentioned, that really showed that chiropractic has become really popular in the last 15, 20 years. So why don't you tell me, in your opinion, why that's happening?
I would have to say, Jeff, that more and more people are flocking to chiropractic care simply because it works. It's very simple. Most of the things that we do are virtually painless for the patients that are coming in. And it works for all different ages, from very young children all the way to the oldest person I have in my office is over 90 years of age. Okay. So it works on a broad spectrum of people and on a broad spectrum of problems as well.
Okay. Now, for people that don't know what chiropractic is, why don't you explain to us what it is, how it works?
Right. The very first time I saw a chiropractor, I was 16 years old, and I had an injury that had happened to my low back, and it's an injury that's referred to as sciatica. Okay. In my case, I had pain that was shooting down into both of my legs, and my family doctor, in fact, the gentleman that delivered me, gave me the only option, which at that time was surgery. Now, my grandfather had seen chiropractors for years. He said, Max, why don't you go try this before you go see that surgeon, because just like you go to a baker, they want to bake everything. If you go see a surgeon, they're going to want to do surgery on everything. So I went to see that chiropractor, and what he did is he looked at my spine. He said that you have an area down here in your low back where there's a bone that has come out of place and it's begun to put pressure onto a nerve, and that nerve runs down your leg into your feet and your toes. So we're going to move that bone back into place, taking pressure up off of the nerve, and then the body will respond by healing itself. And obviously the results speak for themselves because I'm here now with you answering these questions. Okay, now I know you brought a spine with you, right? Why don't you go ahead and demonstrate for people at home exactly what it is you do, because a picture's worth 1,000 words. So explain to us what that doctor did and how that works. Okay. The very first thing that he did is he took a look at my overall posture, how I was standing. He also did a very thorough orthopedic, neurological, and a chiropractic examination, which was a very detailed analysis of each and every one of the vertebrae in my spine and how they were sitting. Okay. He looked at x-rays, and he was able to show me that in this low back area, a bone had come out of place and it was putting pressure onto the nerves that run down through this area into my legs. So he put some specific pressure onto this area, moving that bone back into place, and it got better. Okay. Simple as that. That makes sense. So then basically he took the pressure off the nerve, and the pressure on the nerve is what was causing your pain and sciatica. Correct. Okay, so then how does he do that? When how do you realign the spine back in place if you find something in there that's out of position or whatever? How do you do that? How does a chiropractor correct it? That's a great question. Very simple. He had me laying down like this, and he took his hands and he applied some light pressure into the muscles, into the ligaments in that area, and he adjusted that vertebrae back into place, taking pressure off of the nerves. Okay, so he uses hands then? Yes. Chiro actually means hand, and practic means done by. So anytime you see a chiropractor, they're going to be doing something with their hands to relieve pressure on the nerves in the spine. Because the entire body is controlled by your brain and your spinal cord. Out through all of these little openings that you see on each side of the spine here, Jeff, you see all of these nerves that are coming out. And if one of these bones comes out of place, it can put pressure onto that nerve and cause an irritation and interference, what we as chiropractors call a subluxation. Okay. If you have a subluxation, then a chiropractor can help you. If you don't have one of these, then we're not going to be able to help the situation. All right, now what does it feel like to get adjusted by a chiropractor, to have someone like yourself use your hands to align the spine and do that? What does it feel like? Most of the time it's painless. However, in some people's cases, if they've had pressure on the nerves for a number of years, the very first time we do this, there may be a little bit of discomfort, but the same amount of discomfort as if you went to the gym for the first time and you hadn't worked out in a long time. You're going to have some soreness in the ligaments and the muscles. But it just feels like someone's placing their hands on your back and placing some pressure into your spine.
Okay. Now, I know you mentioned to me before the interview here that your office really focuses on not only correcting somebody, getting them out of pain, but you want to get to the cause of the problem and correct that completely. So explain how that works, because, you know, again, I think a lot of people have the impression that chiropractic is just good for pain relief and certain things. So explain to us that corrective philosophy that you have.
Right. Well, the entire body, as I said earlier, is controlled by the brain and the spinal cord. And as long as you have all of these nerves running out into the body without any pressure or any interference with them talking to all of the cells in the body, your body is going to stay in an optimum state of health. Okay. If you have one of these bones that begins to irritate a nerve and causes a subluxation, it begins to shut the body down. Shut it down so that maybe you're not at 100%, instead you're only at 80% or 70%. And over time, if that goes on, a person can slowly begin to wear down and wear down. So when we say we are going in and correcting the cause of a problem, we are going in and removing that interference and then allowing the body to heal itself, rather than giving someone drugs and covering up the cause of the problem, which a pill is just going to cover this type of thing up. It's not going to get rid of pressure on a nerve.
Now, I know you also have some computerized technology in your office. Explain to us about the computer testing that you do and what that's for.
Yeah. We have a computerized EMG, and an EMG is basically an electromyelograph. It's looking at the electrical activity of the muscles along each side of the spine. Anytime you have irritation of one of these nerves, meaning the bone comes out of place, irritates that nerve a bit, it's going to change the electrical activity that's coming out of that nerve area. So this computer technology allows us to see exactly where the disturbances and the interferences are. So then we can go in and say, here is where it's at, here's exactly what we need to do to get this pressure, this irritation removed, and then allow the body to do its magic.
Okay. Now, I know you mentioned, too, also that you want to give people that are watching the show tonight a gift for watching. Why don't you explain to us what that is?
Right. Anytime I go out and I do a special program like this, or I'm out in the community teaching a workshop, we always offer people the opportunity to come in and receive an evaluation at our office. Now, what is an evaluation? First of all, it's a very thorough orthopedic, neurological, and a chiropractic examination, which again is a very detailed analysis of every bone in your spine. That alone is $100. Then we will also be running an EMG, as we had just mentioned, and the EMG by itself normally is $250. And if x-rays are necessary, those are generally $100 as well. But through programs like this, we offer those services for $27.
Well, I've been going to a chiropractor since I was 12 years old, and I suffered from three pretty major things. One of them was migraine headaches. I used to get them frequently. I got the kind of migraine headaches where you'd be nauseated and have blurred vision out of your eyes. I also suffered from allergies. I was allergic to just about everything, and asthma, really, really bad. I mean, I couldn't even run without wheezing. And ever since I've been going to a chiropractor, a lot of things have changed. I have no more migraine headaches. I can't even remember the last time I had one. During the allergy season, when everybody's sick, taking medicine and everything, I no longer need to worry about any of that stuff because my allergies do not act up anymore. And then as far as my asthma, I have not had to take my inhaler for probably the last 7 years. So it's really helped a lot in my overall health. I would basically tell anyone who is thinking of going to a chiropractor that is absolutely, if they care about their health and they want to live a healthy, pain-free life, that they have to go see a chiropractor, because it will be the best investment in their health they'll ever make.
We were rear-ended when we were in Portland, had a car accident, and it made sense to go to a chiropractor when we went and saw him, and he helped us get through that rear-ending incident, and since then I was hooked. My children, I took them to chiropractors since they were real young. They're not afraid of doctors because they've been involved with chiropractic.
About 35 years ago is when I first went. I threw my back out, and I happened to be next to the Gonstead Clinic in Mount Horeb, Wisconsin in them days. And that was my first experience. And then I had numerous car accidents and a motorcycle crash, which I broke 25 bones. And without chiropractic, I probably wouldn't be able to play golf today. I'm a 6 handicap now, and I don't think I'd be on the golf course if I didn't use chiropractic treatment at least twice a week. Anytime you've had an accident, anytime you've taken a fall, your recovery rate will be much quicker through chiropractic.